Okay, so before I go into the patient's room, I would have received report, gotten doctor's order, read up on the patient to make sure that I know who the patient is. And before I go in, I'm going to knock to make sure I get consent before going into the patient's room. I'm going to do my hand hygiene, either wash my hands or use a hand sanitizer. And when I go in, I'm going to do a point of care risk assessment to make sure there's no hazards. If there's any clutter, I'll declutter. I'm checking the bed bricks to see that the bed is stable, and I see that the handrails are up, and I see that the bed is low at a safe height. I'm also going to be looking out for the oxygen to make sure it's working, the suction and everything needed in an emergency situation is working. So this I'm doing just for the purpose of the OSCE. If not, I'll introduce myself first to the patient. So right now I'm going to approach the patient and introduce myself. Good morning, my name is Adora and I'm a student nurse. How are you doing today? The patient responds, and I'll go ahead and confirm that I have the right patient. So I'm going to be asking her for her name and her date of birth as to patient identifiers. Hi, what's your name? She tells me her name. I see her name is, she says her name is Jane Jackson, and she tells me her date of birth. I'm just going to confirm that I have the right patient, and I do have the right patient. So I'm going to let the patient know what I'm doing right now. So hi Jane, so I'm here to do a quick head to toe assessment, and I'm going to be taking your vital signs. Can you tell me where you are? I'll get consent from her, and then she gives me consent to go ahead. Is it okay for me to go ahead? That's okay. So can you tell me where you are today? She tells me where she is. Can you tell me what time of the day it is today? She tells me where she is. So that tells me that she has a good level of consciousness. So I'm going to be asking her if she has any pain. So do you have any pain today? She tells me she's in a bit of pain, and she rates it right now. It's not on a very high scale. And then I'm going to proceed to do her vital signs. So vital signs have been done, and I'm not worried about her vital signs. So hello Jane, I've taken your vital signs, and they're all at baseline. I'm not worried about there's nothing to worry about your vital signs. So I'm going to be doing a focused assessment on your abdomen. So this is just basically because you're MPO and because you have Crohn's. So I'm just going to be making sure that the symptoms are not progressing, or you're not experiencing more symptoms. Any nausea or vomiting, and she'll respond. Any cramping in your abdomen, should respond. How's your appetite been? And is your mouth feeling dry? If your mouth is feeling dry, I could give you some ice chips to help you wet your mouth. And have you passed gas at all? Okay. And when was your last bowel movement? She tells me about her last bowel movement. How's your appetite? Right. Are you feeling a bit weak? Okay, that's expected. And what's your energy level like? Okay. All right. So I'm going to inspect your abdomen to see that, make sure that there's no swelling. So I can't see any swelling. I can see you don't have any skin breakdown. That's good. So right now I'm going to be listening to your abdomen. I'm going to be listening for your bowel sounds to see if you have bowel sounds. Okay, I've checked your bowel sounds right now, and bowel sounds are present. Okay, so before I listen, I'm just going to put your bed up to a safe height. So I'm going to a safe height, and then also for privacy, I'm just going to draw the curtains, and I'm only going to expose the part of your body that needs to be exposed. And I'm going to be using my stethoscope. So I've listened from the right lower quadrant and up to the left lower quadrant, and bowel sounds are active on all four quadrants, so I'm not worried about that. So Jane, is it okay? I'm going to be feeling your abdomen to be sure that there's no tenderness or any soreness. Just let me know if you feel any pain. I'm just going to put this down, and let me know, are you feeling any pain? Are you crampy? Are you sore? Okay, Jane has expressed that she's not feeling any pain at the moment. All right, so I'm going to be assessing her PICC line. Oh, Jane, I see your dressing is not I see your dressing is not intact, and I see there's a bit of bleeding underneath. So I'm going to be changing your dressing. And the reason why I'm changing your dressing, like I said, your dressing is not sticking properly, and there's a risk of your PICC line falling off, and we don't want that, because that's where your nutrition, that's where you're getting your nutrition right now, seeing that you're not having anything by mouth. Is it okay to go ahead and do a dressing change? Okay. I'm still going to put your bed up for a good working height. Okay, so I'm going to perform hand hygiene. I'm going to perform hand hygiene and wear clean gloves. So to take off our old dressing, hand hygiene. This is strong. I'm going to clean gloves. I'm going to be taking off her old dressing. So while I'm taking off the old dressing, I want to make sure I'm going to roll up to the sides gradually to the site of insertion, and I'm making sure that I'm holding this down so that I don't risk pulling out the PICC line from the site of insertion. And I'm doing that gently so it's secure, and I'm avoiding touching the site of insertion. So, Jane, are you feeling any fever or chills, any soreness? Okay, nothing. So I've checked to see if she's feeling any pain in relation to her PICC line, and there is nothing. So I'm also, at this point, I'm also going to let the patient know to put on a mask, so that just in case they sneeze or cough, it does not go into the side of insertion to cause an infection. And I'm also going to be putting on a mask as well, so that I don't spill on the patient for infection. So right now, hand hygiene again, and now I'm going to be opening my sterile tray for sterile dressing. So I have my supplies here. So I have my sterile gloves and my sterile dressing tray. So I'm going to be opening my sterile tray, and I want to try as much as possible to maintain sterility. I want to verbalize that I would have wiped off the surface to make sure that it's not contaminated. And this is this. And this. Okay. I'm going to be putting all my supplies in. Still maintaining sterility. Everything I need, I'm going to be putting everything I need in here. So, dressing. Just in case. Dressing. And maintaining sterility as much as possible. So it's a double lament, so I need to. So while I'm doing this, I'm going to be explaining to the patient or maintaining a conversation my adapter and my chlorhexidine. I'm just going to prepare them so that it's easy to grab and prepare as much as needed. Okay, 2 and 3. So these are my chlorhexidine swabs. Okay, so for this now, because I have touched this with my hand, the packet, it's no longer sterile. So normally what I would have done is to remove the chlorhexidine swabs and put them in here so that they remain sterile. But again, for the purpose of OSCEs, I have just done them like this for easy grabbing. So now I'm going to put on my sterile gloves. Okay, so now I'm going to adjust as needed, adjust as needed. Okay, Jane, so I'm going to be cleaning your dressing site just to get rid of the remaining blood, and I'll wipe down, and I'll also flush to make sure that your line still works, that your PICC line still works, since you're receiving nutrition from it. So I'm going to start by cleaning a larger portion, a larger area than the dressing. So I'm going to use this. Pull out. So I'm going to use my hands right now and grab. So okay. So first of all, before I start to wipe, I'm going to do a migration check to be sure that the PICC line is not out much more than 3 centimeters, you know, compared to when it was inserted. So when I see that it is good. So now if I have a securement device, I'm going to be securing the PICC line again to avoid further migration or migration at all. So I'm going to wipe out, wipe out, wipe out, wipe out. Again, a portion larger than the area of the dressing. Wipe out and rub. Let me take another one. So now I have my securement device, so I'll wipe underneath. Underneath. Make sure that it's loose enough so that it can go underneath. Okay. So I'm wiping. I should tuck this out, but then I'm also going to clean the site of insertion too. Just because I have minimal. So I'm going to clean the site of insertion. Tuck this out. I'm also going to clean and wipe down. So again, at this point, this is secured. I'm just going to take my dressing. Okay. And so I'm going to be swabbing this area for 30 seconds, but again, as per OSCE and time limits. So I'm swabbing the area for 30 seconds and I'm going to let it air dry before I put on new dressing. And I want to make sure that, you know, the insertion site is visible. So I'm going to use this as my securement device. And while I'm doing all this, I'm informing the patients, letting them know of each step. Letting them know if they feel any form of pain, if they feel chills, or any abnormalities, they need to let me know so that I can give an intervention. Trying to pull this out. Okay. 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 So this is securement device for now, and then I'm going to wipe the rest of the line. So I'm going to wipe the rest of the line down, to wipe down with for 30 seconds. Wipe down and wipe the skin with a different swab, and I will toss one more. All right, so I'm cleaning down away from the insertion site. Now I'm going to be cleaning the hub and flushing the hub. So Jane, I'm going to be wiping your hub and making sure that your line still works like I told you earlier. So the first hub, I'm going to scrub for 30 seconds. So I'm going to take this off. It's the old one. Toss it away, and then I'm going to scrub the hub. Give it a good scrub. Give it a good scrub for 30 seconds, and then I'll let it dry. While that is drying, I'm going to flush. This is what I'm going to be doing. I'm going to prime. I should have done that already, so I'm going to prime to make sure so it works. And insert, and then open this. So before I flush, I'm going to aspirate to make sure to aspirate for blood return, and I see blood. Once I see blood here, and then I'm going to turbulent flush, push, pause, push, pause, push, pause, push, pause, push, pause. So if there's any clot, it goes. So I'm done with this, and after that I'm going to be toss this away. I'm going to be capping. All right, so I'm going to be putting a new cap. We'll also expect those orders. Now I'm going to be wiping the second hub. Take off the old cap, toss in the trash can. I'm going to scrub the hub again for 30 seconds. I'm going to let it dry, and I don't have a second adapter, but I'm going to connect, open, make sure there's blood return, and there's blood return, and I push, pause. And then I'm flushing with 10 mils normal saline for each hub. 10 mils, that's what's as per Northern Health policies. And again, I tussle it. I put on a new cap and a lock and a lock. Okay, Jane, your dressing is all changed now. Please, if you notice any redness, any swelling, any sore, any fever, please don't hesitate to press your call bell. And I'm also going to be documenting, putting my name, the date, and the time that this dressing was changed, so that the nurse knows when to do another dressing. So your dressing will be changed every 7 days or when needed, just like today, when there's any leakage or when there's any blood. So just let me know. So I'm going to put your, do you have any questions for me, Jane? Okay. So I'm going to put the bed back down to a safe height. So before I go, you've been ordered TPN for the next 7 days. So I'm just going to get your TPN. So that's just, it's like your food. That's how you're getting your nutrients, because you can't take food in by mouth, right? Because your body is not absorbing nutrients. That's why you're getting your nutrients through PICC line. Do you have any questions for me? Okay, so I'm just going to put your bed back down to a safe height. Okay, so before putting her beds down, I'm going to take my gloves off and perform hand hygiene. I'm taking my gloves off and clearing the air, and then press everything, and then I'll perform some hand hygiene, and with the bed back down to a safe height. Bed is not going down. Put the wheels on. Okay. Call bell. Let's assume this is her call bell. So Jane, if you notice, if you start to have any pain or if you need anything while I go get your TPN, just press the call bell, okay? If you don't have any questions, I will see you later. Back, okay. All right, I'll take the table away and put everything in the trash. I'll open up your curtains and so that you can see there's nothing in your way. Out. Just to make sure that patient is safe and there's no hazard. And see you soon, Jane.